Surgery can be scary no matter how you slice it. See what I did there? We're at the Illinois Bariatric Center in Champaign with Dr. Rorschad, and you would think we're smack in the middle of a major downtown hospital, but we are not. Tell us about your facility and what you guys do here.
This is an ambulatory surgery center, perhaps many people don't know about. This was built, we're kind of celebrating our 10-year anniversary now. We've been doing bariatric surgery for 20 years, but 15 years ago, the tea leaves kind of suggested that more and more of this kind of work would be done in an outpatient setting. An ambulatory setting is the term we use to describe it, where people go home that day. People return to work more quickly, and people have options for therapy that are, for many patients, more appealing than those procedures traditionally done in a hospital setting.
What types of patients are you serving? Like, how would you know that I should walk through the front doors of this center and go for a consultation?
Well, you know, obesity has been on the rise for 30 years now in Western society. Now it's almost a global epidemic. There's something called the BMI, which is a measure of your height and your weight. Simple calculation. We still have to sort of adhere to those criteria in patient selection. But to put it really simply, if you've struggled with weight for several years and are no longer responding to diet, exercise, medications, traditional non-surgical therapies, investigate it. Most people underestimate the severity of their disease. They don't acknowledge or recognize that they may be candidates for some of the things we do.
Let's talk about some of those things. I think most people are familiar with the maybe stereotypical bariatric surgery, the band thing, which I know is a oversimplification, but you can correct me. But you do other things as well that are maybe less invasive here. So talk about some of those options.
Banding still remains our focus. It's still the majority of the procedures we do. We've done over 3,000 of them now over these last 15 years or more. And it's the most durable procedure in terms of weight maintenance long term. For people that don't really qualify for a band or are not ready to take that step for something even that invasive, there are a couple of other things that have emerged. One is the placement of a gastric balloon, which is a removable implant. We put those in for 6 months at a time by FDA guidelines. Those are then taken out, and the patients continue to be followed in aftercare with our dietary team. There's some other techniques that are emerging that we've started doing, which are endoscopic, so there's no incision with those things. Those are a little beyond what I'd call the trial period. They're showing some efficacy. Essentially, patients just need to come in and explore their options.
I'm sure it's one of those things that there's no one size fits all. Everybody's a little bit different. Talk about what makes you different here. Obviously, we're not a stereotypical hospital, but beyond that, what do you think makes you and this place so much different?
This is all we do. And that's, you know, that's a tremendous advantage because you have a team of people around one medical director that this is their focus, this is what they specialize in. And patients recognize that when they come into this environment, that this is what we do, this is what we've done for a long time. And, you know, it's shown in all around the country that places that are set up like this have great outcomes.
You're the one with doctor in front of your name, but you have a big team that helps you do what you do. Talk about them for a second.
A well-honed team. Not big, but covers all the bases. We have 3 dietitians, which are essential to the preoperative and the aftercare component of what we do. I have a incredibly reliable, what we call physician extender, physician assistant. We have to have the full complement of people to run an operating room, which is a nurse manager and a surgical tech and recovery room nurses. And then you always have to have office managers and marketing people. But we all do the same thing. Any one of these ladies can answer the phone and answer any question. So there's there's cross-training in a group this size.
For sure. Well, thanks for showing us your facility. It's beautiful. The team is fantastic. And if you want more details about Illinois Bariatric Center, you can get all of those on our website. Get a consultation scheduled at ciliving.tv.